you are new to TearLab or need a review, this video provides an overview of 10 TearLab testing reminders. Reminder number 1. Enter correct calibration code on the test card into reader. All test cards in a single box will have the same calibration code, so once you enter the code into the reader for that box, the same code will appear automatically whenever you dock the pen into the reader. When you open a new box, however, the test card code may be different. It is vital that you enter the new code to ensure an accurate test result. Also, note that the code must be entered for each pen, and you must ensure that both pens are using the correct code. Reminder number 2. Ensure that the patient has not used therapeutic eye drops within 2 hours prior to testing. Therapeutic eye drops are designed to stay in the eye for extended periods of time to provide a therapeutic effect. You do not want to test the osmolarity of artificial tears, but the natural tear fluid. Ask the patient before you perform the TearLab test if they used eye drops within the last 2 hours, and if so, testing must be deferred to ensure you get accurate results. Keep in mind that it is not unusual for patients to use drops prior to visiting the eye doctor, similar to how patients brush their teeth and floss just before visiting the dentist. Reminder number 3. Do not test a patient within 15 minutes of the use of anesthetic or mydriatic dilating drops. Eye drops used by the clinic staff to dilate or anesthetize the eye will dissipate rapidly. After 15 minutes, the natural tear fluid will return and will not affect the test results. Reminder number 4. Do not remove the pen from the eyelid when testing a patient with little tear fluid. If a tear collection proves difficult, follow these steps. First, lower the test card flat onto the bottom eyelid. Do not remove the test card from the eyelid, but press down further on the eyelid to bring the bottom of the test card in contact with the tear meniscus. If you do not hear a beep, brush the test card laterally along the eyelid, just 1 to 2 millimeters left and right. Remember not to touch the eye itself and stay away from the cornea. If you get frequent below-range errors, this could be due to a poor collection technique called pecking. Removing the pen on and off the eyelid and then on again can create several partial tear collections with air gaps that result in a below-range reading. Reminder number 5. Use electronic check cards each day and wait for the green light to go off before docking the pen. The blue electronic check cards, which are identical, provide a simple and quick way to confirm that the hardware and electronics within the reader and pen are functioning properly. The electronic check cards should always read 334 plus or minus 3. As a reminder, they do not measure tear fluid or solutions and should not be used for testing on a patient. It is important to use the electronic check cards once per day on the days that patients will be tested to confirm that the system is working properly, or if, for example, you dropped a pen and want to make sure that it is not damaged. Record the test result in the quality control log. Reminder number 6. Verify the accuracy of each new test card shipment by testing with control solution. The liquid control solutions test the total TearLab system, including the hardware, the software, the testing environment, and the user. You should always test control solutions when you purchase and receive new test cards or to determine if temperature fluctuation is affecting test results. For U.S. customers, it is not necessary to perform QC testing on every box received, just on every lot number. The lot numbers are printed on a label on the outside of each box of test cards. U.S. customers should take 2 test cards from each lot and test a high control solution with one card and normal control solution with the other test card. You should record the results in your monthly QC log. Reminder number 7. Leave the TearLab unit on 24 hours a day, 7 days a week, and ensure the pins are seated securely. Confirm the pins are fully charged before use. Confirm the pin is properly docked in the reader by the appearance of the battery icon. Keeping the unit on avoids the necessary warm-up period required if you turn the device off. In addition, the pin battery is permanent and is designed to last the life of the pin. But the pin life and battery can be adversely affected if the battery is allowed to completely drain to zero. Leaving the reader on 24 hours a day, 7 days a week ensures the pins remain charged, extends the life of the pins, and avoids the warm-up time. Testing when the pin battery is low may result in error messages. Reminder number 8. Reset the pin with the magnet on the side of the test card tray, or use the magnetic sleeve if you get an error message. If you use the magnetic sleeve, hold the pin in the normal testing position and align the magnetic sleeve so that the magnet is on the right side of the pin. Hold this position for 5 seconds, and when you remove the magnet, you will hear 2 clicks, indicating the pin has been reset. If you do not hear 2 clicks from the pin when the magnetic sleeve is removed, the pin has not been reset properly. In such a case, repeat the process until you hear 2 clicks. Also, always be sure that the pin batteries are fully charged. If you use the test card tray magnet, orienting the pin against the magnet on the side of the test card tray will ensure that the pins are reset properly. Place the pin against the magnet for 5 seconds. When you remove the pin from the magnet, the pin has properly reset once you hear 2 clicks. Reminder number 9. Keep test cards, reader, and control solutions at the same temperature to avoid variance. Always store test cards for patient testing in the test card tray attached to the reader and maintain at room temperature, which is between 68 degrees and 77 degrees Fahrenheit or 20 to 25 degrees Celsius. Temperature affects the osmolarity calculation when a test is performed. It is important that the reader is not influenced by external heating or cooling sources. This applies to the test cards and control solutions as well. To ensure an accurate reading, be sure the reader, test cards, and control solutions are all at ambient room temperature. In addition, test cards can be damaged if they are stored at a warm temperature outside of the recommended temperature range. Performing regular quality control testing with the control solutions will identify any temperature issues. Reminder number 10. View additional training videos on TearLab.com under Resources. There you will find additional training videos such as how to test, quality control solutions, electronic check cards, and more.